do it. Okay. Okay. So when we say alcohol dependence and treatment, what exactly we mean by that? So unfortunately, as I mentioned to you earlier, that in Pakistan, people don't accept alcoholism as a problem. In Western world, alcohol is open. So anybody can, above the age of 18, can go into the liquor shop, buy the liquor, consume alcohol. So it is socially acceptable. In Pakistan, it is not socially acceptable, so people hide it. But it is not that it's not common. According to one of the studies, it is about 7% in general population. So 7% of the general population is having alcoholism. Not only alcohol, but alcoholism. So people do taste alcohol once in a while. Majority of the youth, they do taste it, not because they want to consume alcohol, but because they want to feel gay. What is it? So as an experiment, in teenage, people do experiment things. So alcoholism is a different terminology. Let's start what I have to say about it, and then you can ask me the questions and I can respond to it. I don't know if I'll be able to complete this presentation or not, but I will try to cover most of the topics related with it. एक हमद है ए खुशनुमा हम मिसाल आदम जहां से गुजरे जमी को अपना वतन बनाया जिधर नजर की उसे खुशी चमन बनाया जो बेवतन थे वो खो गए राहगीर बनकर जमी पे बसने की बेवजह सी लकीरें बनकर तुझे ना देखा तुझे ना पाया मगर गुमां है कि हर अदा में ज़हूर तेरा है बदलती रुत में जो फूल आते हैं उनसे सारा सुरूर तेरा है. This is just again the beginning. So alcohol use
सर
disorder.
आप इसको स्लाइड शो कर सकते हैं ताकि हमें स्लाइड ज्यादा क्लियरली नजर आए.
आपको स्लाइड्स पूरी नजर नहीं आ रही?
नहीं, वो साइड पे अगली स्लाइड्स भी आ रही हैं, तो आप इसको स्लाइड शो कर दें फिर.
Okay, so this is a slideshow.
ओके सॉरी.
No, I will do the otherwise so you can see it
ओह
properly.
यस नाउ.
You can see the slides now.
जी जी.
Before, chalo, is tarah kar lete. Okay, let's hope I'll be able to. Okay, this is not actually a slide share, but this is just a slide view. So I hope this is more clear to you. Continuing, alcohol use disorder, which includes a level that's sometimes called alcoholism, is a pattern of alcohol use that involves problems controlling drinking, being preoccupied with alcohol, continuing to use alcohol even when it causes problems, having to drink more to get the same effect, or having withdrawal symptoms when rapidly decrease or stop drinking. Binge drinking, a pattern of drinking where a male consumes 5 or more drinks within 2 hours, or a female downs at least 4 drinks within 2 hours. So let me explain this thing that tasting alcohol is not alcoholism. Social drinking never comes in alcoholism. So people in the West, they go to the parties, big parties, they take liquor in small amounts, just in a social gathering, maybe a drink, and then they go back and they never are considered alcoholics or having alcoholism. Manu, can you mute this? Okay, but generally, Pakistan, the trend is different. So in most of the countries, where alcohol is restricted, the alcohol is taken as a binge drinking. And binge drinking is 5 drinks for males in 2 hours and 4 drinks for females in 2 hours. 2 घंटे में बैठ के आपने 5 glass पी लिए. So a drink, what is a drink? I will explain that to you as well. How much is the quantity of alcohol in it? So let's move forward. Symptoms: being unable to limit the amount of alcohol you take. So you don't stop with one drink, you keep on drinking till the time you are actually intoxicated or you are having problems. Usually in teenagers in the Western world, they do binge drinking in the beginning, just to have a feel of intoxicated effect. But then afterwards, they learn that this is not a good thing, good way of moving forward, because then they vomit, they have other stomach related issues, there are withdrawals in the morning, you have headaches. So people then try to change themselves into rather a binge drinking to alcoholism. But again, alcoholism is a condition where there is a dependence. Taking alcohol is not dependence in the beginning, but just like smoking cigarettes or weed or anything else, if you take one puff or a cigarette maybe once in a year, it's not alcoholism or again a dependence. Dependence comes when, as I mentioned to you earlier, when you start taking alcohol despite knowing that it is causing a problem, wanting to cut down or making unsuccessful attempts to do so. So I am drinking 4 drinks every day and I'm not able to cut them down. Spending a lot of time drinking, getting alcohol or recovering from alcohol use, feeling a strong craving or urge to drink alcohol, failing to fulfill the major obligations at work, school, home due to repeated alcohol use, continuing to drink alcohol even though it's causing physical, social, and interpersonal problems, giving up of reducing social and work activities and hobbies, using alcohol in situations where it is not safe, such as when driving or swimming. That is crucial as well. Developing a tolerance, experiencing withdrawal symptoms such as nausea, sweating, shaking when you don't drink, or drinking to avoid these symptoms. So this is a common phenomenon, so I don't want to focus too much on it. Alcohol intoxication causes behavior problems, mental changes. These include inappropriate behaviors, unstable moods, impaired judgment, slurred speech, impaired attention or memory, poor coordination, blackouts where you don't remember events, coma, or even death. That is the problem of alcoholism, just like any other addictive substances. When you don't take alcohol and you are actually having alcoholism, then whenever you don't take it, you have sweating, rapid heart beating, hand tremors, problems in sleeping, nausea and vomiting, hallucinations, restlessness, agitation, anxiety, and occasional seizures as well, which is again a complex situation. What is considered one drink? Now, this is crucial because most of the trainees in psychiatry in Pakistan, they don't know how much is what. So people do take beer, they take vodka, they take scotch, they take rum, they take other forms of alcohol, and how much alcohol is in each of these things. Now, this you have to learn. How much is the alcohol in one can of a beer? How big was the can of a beer? How much alcohol is there in scotch? How much alcohol is there in vodka? In Pakistan, most commonly, these 3 drinks are taken: beer, vodka, and scotch. And all 3 of them are manufactured in Pakistan by 2 major manufacturers in Pakistan. I am not aware of any third of them, but I know this much that there are 2 major factories of alcohol in Pakistan. Rather, some people use the imported ones, which are very expensive, but the local manufactured alcohol is much cheaper than imported ones. What is considered one drink? The National Institute of Alcohol Abuse and Alcoholism defines one standard drink as one of these: 12 ounces of regular beer, right? एक बियर के कैन में 5% अल्कोहल बाय वॉल्यूम मेंशन होगा और उस कैन का 355 mils, which is bigger than a Pepsi bottle, is actually 12 ounces is one drink, or 8 to 9 ounces, which is 237 to 266 milliliters of malt liquor. This is about 7% alcohol. The or 5 ounces or 148 milliliters of unfortified wine, which is about 12%. or 1.5 ounces, which is just 44 milliliters of 80 proof hard liquor, about 40% alcohol. Now, beer contains the least amount of alcohol, but people usually don't take beer as one can or one bottle, which comes in Pakistan. Pakistan में जो bottle beer की available है, it is more than a liter. So I don't know the precise amount in it, but I'm sure that it comes in bottle and it's not 355 milliliters. It's at least 750 milliliters. So double the amount means 12 ounces is not there. It's 24 ounces, which means 10% of alcohol, one drink. And people do take 3-4 bottles of beer, which makes it again constituted the earlier definition alcoholism. 5 drinks for male and 1 drink for female. 4 drinks for the female. So 5 drinks means 12 ounces means 355 milliliters of beer into 5. So a bottle of beer in Pakistan, if it is 750 milliliters, if you take 2.5 bottles of beer in Pakistan, which makes it again 5 drinks. Same goes for again the other stuff like hard liquor, scotch, vodka, they contain about 40% of alcohol, which means 44 milliliters, which means about one drink is 44 milliliters, about quarter of a glass, maybe less than that. But if it is more than that, then of course it includes 2 drinks. So यहाँ पे जो use होता है पैमाना for a single drink, it is measured and it is usually 20 mils. You take double, which is 40 mils, which is 1 drink. And if you take 5 of them, it is for males, it is actually alcoholism or binge drinking. So that is tricky. Remember, for females, the quantity is less because of their BMI, and for males, the quantity is more because of their BMI. And 1 drink means about 12 ounces of beer. Yeah, 355 milliliters of a beer into 5 for a male, 240 mils of malt liquor, or 40 mils, 44 is difficult to remember, 40 mils of hard liquor, which is scotch or vodka. 40 mils of liquor will be something less than this glass. So this glass is approximately 225 mils. So इसको आप लगा लें कि इसके bottom पे यहाँ तक अगर alcohol आएगी, so that is 40 mils, which is very small amount considering this. But then people add water, Pepsi, Coke, juice, whatever suits them, and then they take consume the alcohol. And 5 of these shots for male means intoxicated or alcoholism or binge drinking. And 4 of these drinks for the females means drinking. So remember this is important. Now, why people do take alcohol? As I mentioned earlier, that usually the teenage, they want to experiment. So that is social, environmental factors that can impact how drinking alcohol affects. So there are 4 or 5 friends, they want to have fun. So they go to place, get a bottle of scotch or vodka, pour it and drink it. And usually it's the first time drinker, it's very much burning your throat and other stuff. So people dilute it in Coke. But again, if they drink 5 drinks, their body is again getting problems associated with it. There are genetic factors, psychological factors, social factors most commonly, but there are theories which suggest that certain people drinking has a different and stronger impact that can lead to alcohol use disorder. Alcohol use disorders are different paradigms, so they need a different description. I will try to explain all of them as well. कई दर्द पुराने निकले चांद के साथ जो तेरे गम के बहाने निकले, कितने गम थे असीराने वफा, फसले गुल आई फिर एक बार नहाने निकले, अपने पी खून के दरिया में, अपने ही खून के दरिया में, दश्ते तन्हाई हिजरा में खड़े सोचता हूं, मेरा साथ निभाने निकले, हाय क्या लोग. Alcoholism, well, alcoholism means something to people. Some people feel it just a social habit, as I mentioned earlier, but most of the people feel an relaxing effect. So escape from social stresses, psychological phenomena, or reducing the anxiety, or reducing the again panic symptoms, or maybe some obsessionality, maybe depressive symptoms. There is a strange phenomena. People feel that when they drink alcohol, they are more confident, they can talk more. If you historically see, people feel that taking alcohol increases their creativity, just like weed or hash. It's the same. People feel when they are high, they have more motivation, more confidence, more creativity, more things coming to their mind which can make them better people. Actually, it's not like that. It's just the feeling and emotions. It's never accurate. So either the people are having anxiety in performance, so anxiety performance in performance, they try to take something which will tone them down. And I always say, take a tablet of alprazolam, 1 milligrams, or take alcohol. They are equivalent if you have anxiety. But the effect lasts for a short period of time. It's not actually the cure. It's actually a refuge for some people. Risk factors, steady drinking over the period of time. So if I start consuming alcohol, say socially with my friends, once or twice, maybe in a year, and then afterwards I start drinking it every month, and then afterwards I start drinking every week, and afterwards I start drinking alone. That is the most crucial part of dependence. When alcoholism is common, when people start drinking on their own at their places without any friends or company to have a confidence. So when you are taking a history, you always have to ask, do you take alcohol? How much alcohol do you take? What type of alcohol you take? Beer, vodka, scotch, calculate the amount, then for how long you've been taking it, and again, whether you drink it alone or you drink in public with friends. If they are drinking in friends, the chances of dependence and addiction is relatively low, but yes, sometimes these friends always get have a get together every evening to have alcohol. That's tricky. Steady drinking over the period of time, starting at an early age, which is again teenage, experimentation, family history. This may be influenced by genetic factors. Depression and mental health problems are common in alcoholics. It's common for people with mental disorders such as anxiety, depression, schizophrenia, bipolar, PTSD, and OCD. History of trauma, have bariatric surgery, social and cultural factors plays an important role. So it is considered to be glamorous. Even in Pakistan, people who take imported alcohol, they are considered to be glamorous. Okay? And the females, unfortunately, are more hooked onto alcohol when they feel that they want to be glamorous, attractive, charming, and they should be in limelight, which is unfortunately they make things more complicated. Then it has multiple effects on health. So you name an organ and alcohol passes the blood-brain barrier and has an impact on it. So there are liver diseases, digestive problems, heart problems, diabetes, sexual dysfunction, eye problems, birth defects. Birth defect is called fetal alcohol syndrome. So the mothers who drink alcohol and give birth to the babies, they definitely have a brain damage, which is called fetal alcohol syndrome. And it is a definite terminology in psychiatry. Lots of people are diagnosed in West. with fetal alcohol syndrome. In East, because we don't know, the women never comes to you for the treatment, so we don't know the prevalence as well. And no prevalence studies have been conducted in Pakistan about these issues, unfortunately. Bone damage, neurological complications, weakened immune system, increased risk of cancer, and medication and alcohol interaction. Most of these things, people with the alcohol problems, most of these problems, people don't go and see the psychiatrist. Either they go and see the gastroenterologist because of the liver problems, digestive problems, or they go and see the endocrinologist for diabetes, complications of diabetes, blah, blah, blah. Or they go to orthopedics for pains, aches, blah, blah. And then, or they go to some other person having sexual side effects for the alcohol. But they don't come to a psychiatrist, usually. If anybody has a different experience, please update me. Symptoms and effects of alcoholism, as I told you earlier. So these are major actually problems. Heart palpitation, missed heartbeats, muscle system, weakness of muscle, twitching, stomach problems, then lung problems, esophageal bleeds, brain, the most problematic. People have memory losses, they have mood swings, and they have dementia, which I will talk in detail again. What not to do if you love an alcoholic. So it's a common thing that if you see somebody having an addiction, what you do? Well, you usually try to blame them or accept their hurtful behaviors or stay always in the past. पहले तो बहुत अच्छे थे, अभी पता नहीं क्या हो गया है. Or again, they try to make their behaviors controlled by providing them the alcohol at residence rather than drinking with friends and outside the home, which is more complicated. And then you try to help them, but not as professional, but as a relationship. And you feel that the problems will be solved, but they never do that. The difference between the casual drinking, alcohol abuse, and alcoholism. Alcoholism, a dependence or addiction to alcohol, has developed. Casual drinking, a few drinks with friends, having wine with dinner, enjoying a glass of champagne. Alcohol abuse, a pattern of drinking excessively despite negative consequences. Definition: alcoholism, a physical dependency on and preoccupation with alcohol to extent that this behavior interferes with normal personal, family, social, or work life. Alcohol abuse, drinking too much or too often without physical cravings or withdrawal symptoms. Alcohol poisoning and overdosage on alcohol. This is considered a medical emergency. So, alcohol intoxication and binge drinking, when you drink too fast, too rapidly to get the high effect and enjoy that feeling. This is again, unfortunately, is a problem. 5 stages of alcoholism. First, experimentation. Second, adverse effects. Second, increased tolerance. Third, adverse effects. Fourth, dependence. And 5, addiction. These are all 5 the same as any other addictive situation, so I won't be talking more about it. Early stage of alcoholism: drinking to relieve stress, finding reasons to drink, showing a rise in tolerance, and drinking to feel normal. Middle stage of alcoholism: drinking to avoid withdrawal symptoms, drinking in secret, and behaving unpredictably. Late stage of alcoholism: physical and mental health problems, poor diet, job loss, expulsion from school, and lost relationship. अभी तक कोई बात ना समझ आई हो? Oops, I don't see.
Yes, sir. I have a question.
Sure. There are 2
Sir,
raised. I don't. Yeah. Who else? Okay, you have raised the hand. Okay, go ahead.
सर अभी तक तो मैंने अपने सेटअप में अपनी ट्रेनिंग में अल्कोहलिज्म से कम ही पेशेंट्स देखे हैं, लेकिन जैसे जो मैंने 1-2 पेशेंट्स देखे वो आते हैं, वो कहते हैं कि हम देसी शराब पीते हैं. व्हाट इज दैट? उसमें क्या होता है? उन्हें तो नहीं पता कि वो शैम्पेन है या बियर है या क्या है. तो आई एम ऑलवेज कंफ्यूज, फिर मुझे ये नहीं समझ आता कि हमने कैसे पेशेंट को लेके चलना है, या वो हमें हमें कैसे पता चलेगा कि कितना कंटेंट किस अल्कोहल का है। तो पता नहीं है मेरा क्वेश्चन आपको समझ आया या नहीं, बट व्हाट इज दैट, हाउ डू यू
Okay.
प्रोसीड?
So, desi sharab, uh, the more expensive the alcohol is, the more refined it is. So, most of the expensive alcoholic drinks, like you can go and get a bottle of wine for thousands of dollars, लाखों रुपए की एक बोतल, and you can get wine for say 500 रुपए की 300 रुपए. So अब वो फर्क जो हमेशा मैं मरीज को भी समझाने के लिए बात करता हूँ कि अगर आपकी जेब में पैसे हो तो आप सुजुकी गाड़ी लेंगे कि मर्सिडीज लेंगे. हैं तो दोनों गाड़ियां, सुजुकी भी गाड़ी है, 4 पहिए लगे हुए, मर्सिडीज भी गाड़ी है, उसमें भी 4 पहिए लगे हुए, चलती वो भी है, चलती वो भी है. लेकिन अगर आपके पास पैसे हों तो आप मर्सिडीज में लेंगे. क्यों? क्योंकि उसकी ड्राइव स्मूथ होगी, बैठने का मजा आएगा, एसी कंफर्टेबल काम कर रहा होगा, उसमें पावर होगी, वो अगेन उसकी सीटें बड़ी कम्फी होंगी, ब्ला ब्ला. Same is the situation here. The more expensive the alcohol gets, it's more refined and more, again, having the content of alcohol with less impurities. 40% अल्कोहल है तो 60% कुछ और चीज है. वो क्या चीज है? वो जो उस अल्कोहल के अंदर मौजूद है, उस अल्कोहल की बॉटल के अंदर मौजूद है. जितनी अल्कोहल रिफाइंड होती चली जाएगी, वो जो कंपाउंड्स अल्कोहल को के साथ मिक्स हो रहे हैं वो सेफ और अच्छे होते चले जाएंगे. जितनी अल्कोहल क्रूड होगी, उसमें वो जो इनएक्टिव कंपाउंड्स हैं वो डेंजरस हद तक होंगे. देसी शराब जो है, जिसको हम आम फहम में माल्टा भी बोलते हैं, इसके और भी बहुत सारे नाम हैं, मुख्तलिफ इलाकों में मुख्तलिफ नामों से बोला जाता है. माल्टा या देसी शराब जो है वो एक क्रूड मेथडोलॉजी से अल्कोहल को डिस्टिल किया जाता है, और उसमें ऑब्वियसली जो प्योरिफिकेशन और फिल्ट्रेशन प्रोसेस है वो बहुत ज़्यादा अच्छा नहीं होता. हमारे मुल्कों में, देश जो इंडिया पाकिस्तान वगैरह में, देसी शराब इज द चीपेस्ट टाइप ऑफ अल्कोहल अवेलेबल. सो जहां एक मरी ब्यूरी की या क्यूडीएल वालों की बोतल जो है वो 1000 रुपए की मिलेगी, तो देसी शराब आपको 200 रुपए की मिल जाएगी. अब जाहिर है जब वो देसी शराब, उसमें अल्कोहल कंटेंट उसमें भी 40-60% होगा, लेकिन जो दूसरे कंपाउंड्स हैं जो प्योरीफाइड फॉर्म में नहीं है, जो ड्यूरिंग फिल्ट्रेशन प्रोसेस उसकी सफाई नहीं हुई, तो उसमें पॉइजनस कंपाउंड, जिसमें सबसे कॉमनली जो है वो मिथाइल अल्कोहल है. मिथाइल अल्कोहल इज अ स्पिरिट, उसका कंटेंट ज्यादा होगा. दैट इज अगेन टॉक्सिक टू द ह्यूमन बॉडी. सो देसी शराब में प्योरीफाइड होने के बाद भी जो इनएक्टिव मटेरियल है, उसमें जो क्वांटिटी ऑफ पॉइजनस सब्सटेंसेस है वो मौजूद होगी. तो देसी शराब का अगेन इफेक्ट हो सकता है वो एक गेज्ड मीटर्ड अल्कोहल उसके अंदर नहीं है, तो हो सकता है 60% अल्कोहल भी हो, 70% भी हो. स्पिरिट में, जो कि देसी शराब की एक फॉर्म है, उसमें मिथाइल अल्कोहल मिला दिया जाता है ताकि वो खराब हो जाए और वो पीने के काबिल ना रहे, क्योंकि वो पॉइजनस हो जाती है. सो मिथाइल अल्कोहल का कंटेंट उस फिल्ट्रेशन प्लांट पे जो देसी तरीके से शराब बना रहा है उसमें ज्यादा होगा, जो कि आपकी सेहत के लिए ज्यादा खतरनाक है. उसको गेज करना अप्रोप्रिएटली कि वो कितने ड्रिंक्स है, मुश्किल है, क्योंकि उस पर एज सच लेबल नहीं है, उस पर कुछ चीजें अवेलेबल नहीं है. So Desi Sharab is actually alcohol with more than 40% of the content. So you will ask the same question as I told you earlier, that how much do you drink Desi Sharab की बोतल, उसमें कितनी क्वांटिटी होती है? सो से 1 लीटर होती है. अब एक ड्रिंक 40 मिल्स का है, और एक बंदा जो देसी शराब की आधी बोतल पीता है, तो वो तो मल्टीप्लाई इट, तो वो तो 5 ड्रिंक तो ना बने, वो तो हो सकता है कि 15 ड्रिंक बन गए. सो दैट इज अगेन causing intoxication and then physical health problems and then complications. और उसकी डिपेंडेंस और एडिक्शन का प्रॉब्लम रिलेटिवली ज्यादा चांसेस है, बिकॉज आप बिंज ड्रिंक कर रहे हैं, मैसिव ड्रिंक कर रहे हैं, और आप में पॉइजनस सब्सटेंसेस की क्वांटिटी भी बढ़ती चली जा रही है। सो उसको शायद ट्रीटमेंट की ज्यादा जरूरत हो एज कंपेयर टू दी अदर। मैंने क्वेश्चन का जवाब दिया?
जी सर, आपने दिया, यानी कि हम एग्जैक्टली क्वांटिफाई नहीं कर सकते कि उसमें अल्कोहल कंटेंट कितना है, तो हमें एक अप्रोक्सीमेशन पे चलना पड़ेगा, राइट? मैं सही समझ रही हूँ?
उसमें हम प्रिसाइजली नहीं कर सकते, लेकिन एक शख्स आके आपको कहे कि जी मैं मरी ब्यूरी की जो स्कॉच आती है उसकी एक बोतल जो 500 मिलीलीटर्स की है वो आधी बोतल रोज पी लेता हूं, तो आपको क्लियर हो गया कि 250 मिल्स पर डे, आप उसको 40 से मल्टीप्लाई कर दें, 4 5 20, सो तकरीबन वो 6 ड्रिंक्स अल्कोहल के आप वो ले रहा है। मींस वो बिंज ड्रिंक, और अगर वो 2 घंटे से कम टाइम में पी लेता है तो वो बिंज ड्रिंकिंग कर रहा है, मींस कॉम्प्लिकेशंस ज्यादा होने के चांसेस, राइट? सो ये थोड़ा सा गेज करना, उसको थोड़ा सा आपको खुद मॉडिफाई करना पड़ेगा। एंड विद द पैसेज ऑफ टाइम व्हेन यू विल कीप सीइंग दीज पीपल, जो कि मुश्किल होता है, जैसे मैंने पहले कहा कि साइकाइट्री में अल्कोहलिज्म कम प्रेजेंट होता है एज कंपेयर टू दी अदर स्पेशलिटीज, तो थोड़ा सा मुश्किल होता है। किसी बशर में हजार खामी, अगर जो देखो तो चुप ही रहना। किसी बशर का जो राज पाओ या ऐब देखो तो चुप ही रहना। अगर मनादी को लोग आए, तुम्हें कुरेदें तुम्हें मनाएं, तुम्हारी हस्ती के गीत गाएं, तुम्हें कहें कि बशर में देखी बुराइयों को बयान कर दो तो चुप ही रहना। सो बी नॉट बैक बाइट, गीबत बुरी बला है। ओके, 4 स्टेजेस ऑफ रिकवरी। व्हेन यू स्टार्ट द इंटरवेंशन, वो ट्रीटमेंट की भी हम बात करेंगे, तो रिकवरी प्रोसेस में क्या है? 1, withdrawal stage, then abstinence stage, then the repair stage, and then the growth stage. These are actually the 4 stages, just like the 4 stages of any addiction. So जो motivational interviewing है, जिसमें pre-contemplation, contemplation, again intervention, और फिर motivation, और जो भी उसकी तीसरी और चौथी स्टेज है, वही स्टेजेस यहाँ पे भी अप्लाई हो रहे हैं। Withdrawal stage, abstinence stage, repair stage, and growth stage. Usually, the treatment starts with the calculation of the type of the drinks he's taking, how much alcohol he's taking, and understanding all the consequences, psychological, social, genetic factors, assessing the mental health problems, and then intervention. If you won't be able to ascertain the psychological factors, social factors, genetic factors, and mental health problems, then the treatment probably won't be good enough. Most of the Nasha Chhod clinics, unfortunately, they don't go for everything. Alcoholism, आ जाओ, उसको विड्रॉल स्टेज देखेंगे, एब्सटिनेंस स्टेज को काबू करेंगे, भिजवा देंगे, चीजें पूरी तरह रिकवर नहीं होंगी। रिपेयर स्टेज मीन्स दैट यू हैव टू एड्रेस द मेंटल हेल्थ इश्यूज, you have to address the psychological issues, you have to address the social issues, you have to address the biological issues, and only then you can come up with something appropriate. Otherwise, recovery won't be smooth and uneventful. Physical consequences of alcoholism can affect women's menstrual cycle and induce a large fluctuation in hormonal levels, causing her body to grow haywire. Alcoholic women are more prone to develop rhinopima, swelling, cellulitis, anemia, hypertension, osteoporosis, and pancreatitis. Health consequences: bipolar disorders, PTSD, eating disorders, depression, personality disorders, mood disorders, trauma, anxiety. These are all unfortunately comorbidities usually seen in majority of alcoholism. So alcoholism is not actually just one entity. It is comorbid with multiple entities. And if we won't address all of them, we won't get the desired outcome of the treatment. So always remember to assess everything. Now, examination questions. Now, this is complication, but we have to cover it up. So some of the examination questions, especially when you'll be having now the MCQs, so there is a possibility of having these MCQs more. Types of blackouts. According to NIAAA, there are two general types of blackouts that can occur from drinking too much in a single night: complete or fragmentary. Complete blackout, शराब पी, दोनों हुए, गिरे और सब कुछ भूल गए, याद ही नहीं था क्या हुआ. Fragmentary blackouts create memory lapses in small chunks. घर कैसे पहुंचे, भूल गए. घर में जाके कहां सोए, भूल गए. कौन सामने आया, उसके साथ क्या बर्ताव किया, किसको मारा, किसको गालियां निकाली, भूल गए. So fragmentary blackouts, and these both are commonly seen in alcohol. So alcoholism, when somebody asks you, well, in FCPS chances are less, but in most of the other exams, these questions are common because this is considered to be a problem in the Western world. So complete blackouts, fragmentary blackouts, what's the difference between them and how you will differentiate and proceed with that? What happens actually is that the sensory memory transfer and encoding and the short-term memory and the retrieval, alcohol primarily interferes with the transfer and encoding and retrieval. So that is the stage where alcoholism interact. Short-term memory never gets disturbed. So, but of course, the rehearsal is not there. So encoding won't occur. It won't become the part of the long-term memory. So he will forget. And if it is a long-term part of the long-term memory, alcoholism usually abolishes that and the retrieval is difficult. This is why most of the people, again, PTSD in Pakistan is relatively less common or less diagnosed. It is common, but it is not diagnosed as much as we should be diagnosing it. इस पे मेरी कुछ लोगों से बहस हो चुकी है कई दफ़ा. पाकिस्तान में टर्मिनोलॉजी यूज़ होती है कि जी पाकिस्तानी कौम बहुत रेजिलियंट है, इधर भम का धमाका हुआ, उधर जिंदगी नॉर्मलाइज हो गई. It is not actually like that. People do have PTSD. They never acknowledge, they never accept. They live a miserable life, but they don't want to be treated. Same goes here as well. People do have memory lapses because of alcohol. They don't accept it. And when you don't accept it, the family, just मैंने पहले dynamics बताई कि family help करने के चक्कर में उनको कहती है ठीक है कोई बात नहीं, थोड़ी बहुत पीते हैं, अपने आप को कॉन्फिडेंट में रखने के लिए तो पीने दो, which is unfortunately the problem. Phases of addiction. This is called jelly neck curve. Jelly neck curve is actually the phases of alcohol dependency. Progressive phase, when you start drinking. Crucial phase, when you increases and problems emerge. Chronic phase, when problems mount and control disappears. Rehabilitation phase, when you try to get rid of alcohol and get better. And recovery phase, when life is getting back to normalcy. So jelly neck curve, again, phases of addiction में एक सवाल MCQs पे भी है. Progressive phase, critical phase, chronic phase, rehabilitation phase, and recovery phase. So if you have an MCQ related to it, you will be able to know that. अगर हम दूर हो जाएं, कहीं दुनिया में खो जाएं, बताओ क्या करोगे तुम? हमें ढूंढोगे या फिर भूल जाओगे? हमें आवाज दोगे या किसी गुजरी कहानी में हमारा नाम लिख दोगे? चलो ऐसा ही कर लेना, हमें तुम याद मत करना, हमारा नाम मत लेना, हमें तुम भूल ही जाना, मगर इतनी गुजारिश है, हमारा जिक्र जब आए तो थोड़ा मुस्कुरा देना, खुशी का हो या फिर गम का, बस एक आंसू गिरा देना. Okay, I just try to put these things just to give you people a break, but unfortunately when I was putting them, I was thinking that I'll be wasting more of the time and I'll be focusing less on what we have to do. So still too many slides to go. So let's hope that any questions so far? Anybody? No? We are good? Okay. So let's continue. How alcohol affects the brain. Major areas of the brain that are affected with alcohol: hippocampus, hypothalamus, cerebral cortex, cerebellum, central nervous system, including medulla. Sorry, medulla, cerebellum, cerebral cortex, hypothalamus, and hippocampus. Hippocampus, as we understood from now, is considered with the blackouts, fragmentary memory, and again, because of the memory component, hippocampus is the seat where unfortunately alcohol has an effect. Hypothalamus, because hypothalamus controls so many releasing factors, especially in the females, it is affected. Those releasing factors are compromised, and people do have hormonal changes in the body, especially the females. Cerebral cortex, the cells in the cerebral cortex have long Purkinje fibers or axons, and because they are very short, long and thin and can be affected easily, so unfortunately alcohol affects them, and then it causes lots of problems, like it can affect senses, blurring of vision, you fail to understand, you fail to recognize, you fail to comprehend. So there are those kind of problems. Cerebellum, you take alcohol, your balance is disturbed because it is affecting your cerebellum. Medulla, if you take excessive quantity of alcohol, your breathing could be again disturbed, your temperature regulation is disturbed, and your heart rate regulation is disturbed. So medulla is a, so the symptoms, and there is an effect in the brain. Hippocampus, memory; hypothalamus, hormones; cerebellum, gait and posture; medulla, respiration, temperature, breathing, heart rate; and cerebral cortex, the processing, your senses. So that can be compromised. Remember, it's an easy way to remember like this. Bad decisions, frontal lobes, learning and memory, sluggish systems, slowed senses, and hypothalamus. Most of the things. I won't be going into the detail. Alcohol triggers endorphin release. Initially, when you take alcohol, it gives you a very nice feeling. Your pain is gone. You feel relaxed. You feel a sense of control. You don't feel anxious. You don't feel having any traumatic memories of the past, etc., etc. But then it disrupts the neuronal communication, the 5 areas of the brain. It alters the blood flow patterns, like heart rate, oxygenation, blah, blah, and it crosses the blood brain barrier. That is the most tricky component. Most of the addictive compounds, they unfortunately crosses the blood-brain barrier. Most of the drugs, they don't cross the blood-brain barrier. But alcohol and addictive compounds, most of them crosses the blood-brain barrier. That is the more tricky situation. The Korsakoff syndrome, the uncomplicated alcoholism, shared between Korsakoff syndrome and alcoholism. What is this? This question should be important. Well, in examination, this is actually a SPECT scan because it has different colors in it: yellow, orange, red, black, and it shows hippocampus, medial thalamic nuclei, hypothalamus, and the memory bodies, and cingulate gyrus. And red part is Korsakoff syndrome, and yellow part is actually uncomplicated alcohol, when it is just affecting the peripheral system, not actually the main brain areas. And Korsakoff syndrome and alcoholism combined together, it's orange. So exam question, SPECT scan of an alcoholic patient. Always remember, see the picture. You will be guided by the picture. There are 3 different colors. There are 3 outcomes. Reddish area, Korsakoff syndrome. Yellowish area, uncomplicated alcoholism. Orange area, shade between Korsakoff syndrome and alcoholism together. Complicated. This is the SPECT scan. Wernicke-Korsakoff psychosis. The simple word for it is coat rack. Coat rack. Wernicke's encephalopathy is coat, and Korsakoff psychosis is RAC. Quote, vernix encephalopathy, confusion, ophthalmoplegia, ataxia, thiamine deficiency, vernix encephalopathy. अब इसकी मजीद डिटेल बात करते हैं, लेकिन सिंपल वर्ड फॉर वर्निक्स एनसेफेलोपैथी, रिमेंबर कोट. कोट stands for confusion, ophthalmoplegia, ataxia, thiamine deficiency. Korsakoff psychosis is RAC, R-A-C-K. RAC, retrograde amnesia, anterograde amnesia, confabulation, and Korsakoff psychosis. So, COAT, RAC, vernix encephalopathy, and Korsakoff psychosis, two major complicated situations in alcoholism. Question is, what is vernix encephalopathy? Vernix encephalopathy is COAT, confusion, ophthalmoplegia, ataxia, and thiamine deficiency. What is Korsakoff syndrome or psychosis? It's retrograde amnesia, anterograde amnesia, confabulation, and Korsakoff psychosis, which is agitation, aggression, violence, hyperactivity, blah, blah, blah. All of those symptoms. I think I have another slide for that. Korsakoff syndrome. It's a chronic presentation of thiamine deficiency consequent to untreated vernix encephalopathy. So clearly, in the beginning, patient will develop vernix encephalopathy, quote. And then if the vernix encephalopathy stays for a longer period of time, which gets chronic, then person develops Korsakoff syndrome or psychosis, which is RAC. Its differential diagnosis is diencephalon temporal lobe lesions. Confabulation is the memory lapses. So you try to fill in the gaps of missing parts in the memory by false information. That is confabulation. Anterograde amnesia. I'm not able to register and build up the new memory thing. Treatment, thiamine. Major dose of bolus thiamine. And it's usually, if it's vernix encephalopathy, easy to be treated, patient do get well. If a person goes into Korsakoff syndrome, then relatively the treatment is less effective, but still it can work. So vernix encephalopathy and Korsakoff syndrome are the chronic conditions which develops over the period of time by taking continuous amount of alcohol for a longer period of time, and it actually affects the brain. And vernix encephalopathy has symptoms, COAT, and Korsakoff psychosis has symptoms, RAC. Vernix encephalopathy, 2 out of 4. 1, altered mental status or memory impairment, oculomotor abnormality like nystagmus, cerebellar dysfunction, dietary deficiencies leading to thiamine deficiency, leading to brain involvement. Treatment is 500 milligrams of IV thiamine 3 times daily for 2 days, 250 milligrams of thiamine IM for 5 days, and other B vitamins. So, pehle 2 din, usually 500 milligrams of intravenous thiamine 3 times a day, a very mega dose. And then subsequently 250 milligrams of thiamine for 5 days, and then afterwards an oral thiamine for a relatively longer period of time, usually 3 to 6 weeks. Korsakoff syndrome, chronic B1 deficiency, symptoms of vernix encephalopathy, memory impairment, and confabulation, which I told you earlier as well. Recommended regimes for prophylactic vitamin supplementation in alcohol misusers. Okay, I have 2 more minutes, I'm sorry, and then we'll try to cover it up next time. So, recommended regimes for prophylaxis of vitamin supplementation in alcohol misuser. 1, nourish them. Again, take care of the dietary neglect, adequate dietary plans. Neuropsychiatric symptoms needs to be addressed. If there is a mild malnutrition, treat that. Risk of malnutrition, treat that. Compensated cirrhosis, treat that. Acute alcohol withdrawal, treat that. moderate severe malnutrition, significant dietary neglect, poor negligible dietary intake, peripheral neuropathy, decompensated cirrhosis, severe acute withdrawal, treat that. Now, the treatment usually, if you see in the initial phase, then there is no need to treat, but make sure that the person is not taking alcohol further. If it is complicated with the things that I have told you earlier, you give oral thiamine, 100 mcg TDS for 2 to 4 weeks. But if it is complicated, then you give IV in bolus forms for 2 to 3 days, then intramuscular for 5 days, and then oral needs to be continued for 2 to 4 weeks time. Okay, so far, any questions? No questions. अच्छा, मैं देख रहा हूँ लोग कम हो गए, लोगों को पसंद नहीं आया लेक्चर क्या?
नहीं सर, लेक्चर बहुत अच्छा है वो।
अच्छा, लोगों को शायद जरूरत ज्यादा पड़ गई। चांद रात है आज, हज मुबारक और कल ईद मुबारक। Well, I don't know, you people are celebrating Eid on Sunday.
On
I'll be
Sunday.
celebrating, yeah, I'll be celebrating Eid tomorrow. So I hope there was something significant to learn today. So, Chand
Sir,
Mubarak, Hajj Mubarak, Eid Mubarak.
Sir, there is a question by someone.
Yes, sure.
सर
Go ahead.
मेरा एक क्वेश्चन आपको।
हाँ,
सर थायमीन तो हम पढ़ते हैं बुक में कि ग्लूकोज के साथ उसकी जो है ग्लूकोज के साथ नहीं देना या ग्लूकोज से पहले देना है, वो चीज़ थोड़ा एक्सप्लेन कर देंगे। हमें पता तो है, हम बुक में पढ़ते तो हैं, लेकिन वो रैशनल क्या है, क्या वजह है जो अवॉइड करते हैं ग्लूकोज इसके साथ देना, तो वो उसकी रीजनिंग मुझे कहीं से नहीं पता चलती।